Voyager PAD Trial. The impact of rivaroxaban and aspirin on vascular outcomes. Welcome to today's episode, where we take a deep dive into one of the most significant clinical trials in vascular medicine, the vascular outcomes study of acetylsalicylic acid along with rivaroxaban in endovascular or surgical limb revascularization for peripheral artery disease, also known as the Voyager PAD Trial, published in the New England Journal of Medicine in 2020. This landmark study has reshaped the way we approach post-procedural care for individuals with peripheral artery disease. Let us begin with the central question of the trial. Can the addition of a low-dose anticoagulant, specifically rivaroxaban, to low-dose acetylsalicylic acid, improve outcomes for patients with peripheral artery disease who have recently undergone a lower limb revascularization procedure, either through surgery or an endovascular technique? The trial was robust in its design. An international, randomized, double-blind, placebo-controlled study that enrolled 6,564 patients presenting with symptoms of peripheral artery disease. Each of these individuals had undergone a successful revascularization procedure within the preceding 10 days. As part of the background therapy, all participants received 100 mg of acetylsalicylic acid daily. They were then randomized into two groups for the intervention. The first group received the combination of acetylsalicylic acid and 2.5 mg of rivaroxaban twice a day, while the second group received acetylsalicylic acid alongside a placebo, also administered twice daily. It is important to note that, at the discretion of each patient's physician, an additional antiplatelet agent such as clopidogrel could be used. In fact, about 65% of patients initially received this triple therapy. The primary aim of the trial was to assess a composite outcome, including acute limb ischemia, major amputation for vascular reasons, myocardial infarction, ischemic stroke, or death from cardiovascular causes. The main safety outcome focused on major bleeding, as defined by the thrombolysis and myocardial infarction criteria. Now, let us turn our attention to the key findings. The Voyager PAD trial demonstrated a clear benefit to the addition of rivaroxaban, though this came with an increased risk of bleeding. Over a median follow-up period of 28 months, the primary combined endpoint occurred in 17.3% of the patients in the rivaroxaban group, compared to 19.9% in the placebo group. This equates to a 15% relative reduction in the risk of major adverse limb and cardiac events. The reduction was most notable in cases of acute limb ischemia and major amputation. On the safety front, the incidence of major bleeding was higher in participants who received rivaroxaban, with 2.65% experiencing such events compared to 1.87% in the placebo group. This represents a 43% increase in relative risk for major bleeding. Importantly, however, there was no significant increase in the most severe forms of bleeding, such as fatal or intracranial hemorrhage, between the two groups. So, what does this mean for clinical practice? The Voyager PAD trial concluded that, for patients with peripheral artery disease who undergo lower extremity revascularization, dual pathway inhibition with low-dose rivaroxaban and low-dose acetylsalicylic acid offers a significant net clinical benefit. This combination not only reduces the risk of limb-specific events, such as acute limb ischemia and amputation, but also provides further protection against major cardiac events. While clinicians must remain vigilant for the increased risk of major bleeding, the lack of an increase in fatal or intracranial events suggests that the risk is manageable for most patients. In summary, the Voyager PAD trial has established the combination of rivaroxaban, 2.5 mg twice daily, and acetylsalicylic acid as a new standard of care in antithrombotic therapy for patients following lower limb revascularization for peripheral artery disease, so long as they are not at a high risk of bleeding. This strategy builds upon the success of a similar regimen in coronary diseases demonstrated by the COMPASS trial. Thank you for joining us on this evidence-based journey through the Voyager PAD trial. Tune in next time as we explore more transformative studies shaping the landscape of modern medicine. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.